this turns out to be a very exciting time in the treatment of atopic dermatitis. For the first time in many years, we have new therapies that are non-corticosteroid based that can have tremendous impact on our patients with atopic dermatitis. The first of these that I'll talk about is the topical agent that was approved within the past year or so, called crisaborole. And as a non-steroid topical ointment, it's particularly well suited for mild to moderate atopic dermatitis, especially for maintenance therapy, and applying to anatomic areas where we wouldn't be able to safely use topical corticosteroids, such as the eyelids or elsewhere on the face or the body folds. The second big advance is dupilumab, which is an injectable biologic agent for atopic dermatitis. Now, this one is approved for moderate to severe atopic dermatitis, so we're talking about a more severe population than the topical that I mentioned. And this blocks it basically blocks the effects of two cytokines that are important in the pathogenesis of atopic dermatitis, interleukin 4 and 13. And this has really been transformative for our patients with moderate to severe atopic dermatitis in being able to really relieve, reduce, improve many of the manifestations of the disease, both clinically and also with respect to sleep disturbance and itching, which really is one of the more difficult aspects for patients with atopic dermatitis to deal with. 2017 has been a very exciting year for dermatology, and the future looks even more exciting as we get more and more agents that can block specific targets for various inflammatory diseases. In psoriasis, we continue to have recently approved and new agents coming down the pike that can block specific cytokines with fewer side effects than traditional agents. And similarly for atopic dermatitis, there are new products in development, including JAK inhibitors that show a lot of promise for the future of treating atopic dermatitis. In the world of vitiligo, and other pigmentary disorders. And pigmentary disorders as a whole have been an area that have been historically a little underserved with respect to new development, new innovations, but we're seeing a lot of exciting research that may lead to new breakthrough therapies in the very near future for vitiligo and even some disorders of hyperpigmentation such as melasma.
Awesome, thank you.
Okay.